Speaking during the launch of the country's 7th National Health Plan, Professor Mathias Sapuri from the private health sector stated one of the biggest challenges faced in the country in the health space is the lack of infrastructure and human resource development. He commended the 7th NHP for incorporating the human resource component, which was never done in previous national health plans.
I'm very pleased that this National Health Plan, which is basically way smarter and better than the last National Health Plan. Why? Because in this current plan, it brought in the HR component into it. And Honorable Prime Minister, the HR component may sound frightening at a budget of about 90 billion, but it's something that our nation has to invest in to ensure that we train the cadres of all cadres of health workers to implement and to work in our country.
Professor Sapuri said currently only 602 doctors are actively serving in a country of an approximate population of 9 million.
Today, as I speak, there are 602 doctors, including myself, still sitting in the hospital and cutting patients and treating patients. The numbers are low.
Professor Sapuri set out that the ratio of health worker to the populace stands at 1 doctor to 15,000 population, 1 dentist to 64,000 population, and currently 5,000 nurses serving right across the country. Professor called on the Prime Minister and his government to support the development of medical schools.
A medical school that is now producing 45 a year. When I was a young dean 20 years ago, I projected that by now, 2020, we should be producing 200 doctors a year. We were nowhere near that target. I'm glad, Honourable Prime Minister, that your government has approved the legislation to include Divine Word into the program, and now they're going to be producing doctors out of Divine Words. Thanks to the government, thanks to the Minister for Health, and thanks to the Department of Health for driving it and pushing it forward. But the medical schools will need support so that we can increase their capacity to train more doctors, not only just doctors, because the whole medical school is all about training all cadres of health workers.
He further asked the government to continue to support the previous government's investment for the establishment of a standalone medical university. Sapuri stated the university, when established, will link up all nursing colleges throughout the country.
So that those nursing schools throughout the country can be able to progress into developing Bachelor of Nursing program out of them, and eventually into postgraduate training so they can be more midwives, they could be more pediatric nurses, they could be more theatre nurses, so that we can fit them into all the system in our PHAs in the country.
Kilawani National EMTV News.